So yes, so we will start with the today's session of Anatomy MCQ Part 13. So this is the Part 13 of the session. So yes, am I audible? Is the screen clear? So that we can start the session now. Okay. So before starting the session, I would like to give a brief introduction about myself Dr. Monalisa, and today we are covering up with the topic of NEET PG MCQ discussion. This is the part 13 of it. So I have got an experience of teaching from the past 8 years. So before starting the session, I also want to give you the brief of my upcoming sessions. So one of my upcoming session which is going to take place on the Plus platform, that is MCQ marathon. So this is MCQ marathon. According to this session, what I am going to cover up in this session is I am going to cover up the whole anatomy MCQs for the FMGE students so that they can target their upcoming session. This will be beneficial for the students. So those who wish to join this session, actually this session is on the Plus platform, so they have to take the Plus subscription. So this is on the Plus platform of Unacademy. They can use the code ANAT10. Okay, so the benefit of Plus platform as compared to the special platform is that you can have the session, and in that you can avail the opportunity of seeing all the 19 subject in a very systematic way. So all the sessions are very systematically arranged so that you can complete the whole session, and along with it there are many MCQ session, doubt clearing session is there, which is not in the special or the free session. It is not available, and the course is also systematically covered along with all the subject, and also in between there is MCQ session. So these are the benefits. You will get the PDF notes, you can see the recorded version also if you miss the live session. So the schedule is, hello everyone, Kumar and VIP, and so yes, hello to you. So yes, we will start the session now. So this is the schedule of the course, that is on 29th and 30th of the session, and the session is, I will cover up with the upper limb, and lower limb MCQs on the first session 2 hours. So whole session and the course of the session will be 2 hours each, and total of 10 hours is the session in which whole MCQs will be discussed. That is the gross anatomy, upper limb, lower limb, thorax, abdomen, pelvis, head and neck, neuroanatomy, embryology, histology, cadaveric images, and clinical MCQs. So free live sessions on the Unacademy platform. So for availing the opportunity to be the part of free live sessions, you can use the code ANAT10 for unlocking the free sessions on the Unacademy platform. So this is the schedule of my free sessions for this month. So there is on YouTube, I am taking 7:30 PM. As you can see, this is the timing dedicated for the session which will be taking on 7:30 PM every day, and from starting from the 14th May till the 28th of this month, I will definitely cover the important MCQs. Then there is FMGE session on 9 PM. This is on the Unacademy platform. This is a special free class, so you have to use the code ANAT10 for unlocking it. Also conceptual anatomy, those who want to study anatomy from the basics, clearing their concepts. So this is the 6 PM session dedicated to these students. It will be very beneficial for the students who want to target the next examination. Yeah, so let's start everyone. So students has arrived and we can start with the session. So can we start with the first MCQ, everyone? Just so let's start with the first MCQ. Stylopharyngeus muscle is associated with which branchial arch, whether it is first, second, third, fourth or sixth. So your time starts now. So mark the correct answer. So yes, everyone, so you can mark your answer. Yeah, hello to everyone, I think. So your first MCQ start today. Also 10 MCQs are there, so slightly we will try to solve this all MCQs in time. So yes, I got Sam is giving it C as the answer. So what about others? VIP is also telling it C, Acharya is telling it C, Kumaran is telling it C. So most of the Bharat M is telling, see, most of the students are telling it's the answer is C. So the students are perfectly telling the right answer, and the right answer is C. Okay, so this is a direct MCQ, so no need for further explanation, I think. So yes, in brief, I would like the structures derived from the third arch. Okay, so all of you are absolutely right, absolutely right. So when we talk about third arch, third pharyngeal arch, when we talk about third pharyngeal arch, the structures which is derived from the third pharyngeal arch are following, and the nerve of third pharyngeal arch is glossopharyngeal nerve, that is the 9th cranial nerve. It's the glossopharyngeal nerve, that is the 9th cranial nerve, and the structures derived is stylopharyngeus muscle, the greater horn of, and that of the lower portion of body of hyoid bone. So these two structures of hyoid bone. So these are the structures which are derived from the third arch. So most of you, all of you are correct. So let's move directly to the second MCQ. So let's start with the second MCQ. So yes, which of the following muscles has got an insertion on pharyngeal tubercle of the occipital bone? So this is the second MCQ. So mark the correct answer. 5 options are there. A is superior constrictor, B is middle constrictor, C is palatopharyngeus, D is salpingopharyngeus, E is stylopharyngeus. So your time starts now. Take your time. Mark the correct answer. Question number 2. So yes, Bharat is telling it's A. Okay, Bharat is telling A. What about others? Insertion on pharyngeal tubercle of occipital bone. Acharya is telling A. So today's students are giving answers very nicely and on time. Great, great everyone. Great performance. Yeah, so VIP is telling, Kumaran is telling it's A. So most of the students are telling it's A. So yes, no, I got Sam telling us D. Okay. So yes, but most of the students are absolutely right, and the correct answer is A, that is superior constrictor muscle. The correct answer, Sirja, yes, so most of the students are absolutely right. The correct answer is A, superior constrictor. Absolutely right, it's superior constrictor. Okay, so superior constrictor muscle is the correct answer, and I would like to give you the brief about the muscles insertion. So let's discuss. Superior constrictor muscles inserts onto the median fibrous raphe. Actually, when we talk about the constrictor muscles and all, they are all going towards the fibrous raphe. So let's discuss it in brief. So please write down superior constrictor, superior constrictor inserts on median fibrous raphe, median raphe of pharynx, median fibrous raphe of pharynx. So can anybody tell me the extent of median fibrous raphe? Median fibrous raphe extent, actually it's lying in the midline, and it's the position where all the constrictor muscles are interlacing and inserting. So actually, if we talk about the extent, median fibrous raphe is extends from pharyngeal tubercle superiorly to C6 cervical vertebra, and more posteriorly it merges with the posterior wall of esophagus, Okay, so this is about the constrictor muscle which was asked in the MCQ, and we can see it is inserting into midline fibrous structure, median fibrous raphe of the pharynx, extending from pharyngeal tubercle till the level of 6th cervical vertebra. Pterygomandibular raphe is the origin point. It's not the insertion point, Sam, it's the origin. If we talk about superior constrictor muscle origin, so it's from the a raphe is extending from pterygoid hamulus and the mandibular structure. Inside there lies these raphe is giving origin to superior constrictor muscle. When we talk about insertion, it is into median fibrous raphe of pharynx. So, they are different structures. So, if you want, I can tell you about its origin, insertion also. So, write down. So, we have just discussed the constrictor, superior constrictor muscle insertion. Let us discuss the origin. So, superior constrictor muscle origin. So, when we talk about origin, it originates from pterygoid hamulus. It originates from pterygomandibular raphe, pterygomandibular raphe, also from the medial surface of mandible, at upper end of mylohyoid line. Okay. So, also it takes few twigs of origin from the tongue also. It also takes few twigs of origin from the tongue, posterior aspect of the tongue, and from here this is the whole the origin point. These superior constrictor muscle inserts on. So, insertion of superior constrictor muscle occurs on, it inserts on median fibrous raphe. Just now we have seen it inserts on median fibrous raphe, and we know that median fibrous raphe starting point is pharyngeal tubercle. So, this is the correct answer. Superior constrictor muscle is correct answer. All of you are understanding this. Now, there are three constrictor muscle. We have got medial constrictor, we have got also the inferior constrictor. So, let us see the option which was given. So, what was the option given in the MCQ? So, if you will target the MCQ here, the muscle was superior constrictor, which we have already discussed, and now we are knowing that superior constrictor muscle is the correct answer, because its starting part of the median fibrous raphe, superior attachment is seen on the pharyngeal tubercle. So, this is absolutely correct. What about the other option? So, let us move on to the second, that is middle constrictor, palatopharyngeus, salpingo and stylopharyngeus. So, what are the options given? I would like to brief you this about these muscles, and then I will show you the diagram for it. Okay. So, let us rule out all the options. So, correct answer we have approached. Now, let us move on to the incorrect option also. We will see the attachment of these muscles also. So, next muscle was middle constrictor. So, let us move on to the next, that is the middle constrictor muscle. So, middle constrictor muscle, yeah, middle constrictor muscle. Middle constrictor muscle originates from stylohyoid ligament, also from stylohyoid ligament, also from lesser corona of hyoid bone and upper border of greater corona of hyoid bone. So, you can see that this middle constrictor muscle is originating from stylohyoid ligament and that of the hyoid bone. And insertion, if we talk about all the constrictor muscle, they are inserting into median fibrous raphe, median fibrous raphe. So, this was the other option which was provided. Now, moving to the next, the other muscle which was provided in the option was palatopharyngeus muscle. Which one? Palatopharyngeus muscle. So, next one is the other option was palatopharyngeus muscle. Palatopharyngeus muscle. So, when we talk about palatopharyngeus muscle, it is actually originating as two fasciculi, that is anterior and posterior, and these two fasciculi are originating from palatine aponeurosis. So, in short, you can just know that it is arising from palatine aponeurosis, by two fasciculi, anterior and posterior, and it's inserting on, actually platopharyngeus is the longitudinal muscle of the pharynx, so it is inserting into posterior border of the lamina of thyroid cartilage. Of the lamina of thyroid cartilage. So this is about the insertion of the palatopharyngeus muscle. Actually all the longitudinal muscle we have got three, that is stylopharyngeus, salpingopharyngeus, platopharyngeus. All these longitudinal muscle of the pharynx is inserting into the thyroid cartilage posterior border lamina. So let's move on to the, by the name only it is clear, salpingopharyngeus. So salpingopharyngeus, that means it is originating from lower part of the cartilage of auditory tube. AT for auditory tube. Okay. Insertion is same, all the muscles will insert into posterior. So insertion is same, I is insertion, and insertion of all longitudinal muscle, that is palatopharyngeus, salpingopharyngeus and that of stylopharyngeus will be same. So I am not writing for everyone because already we know that these all muscles has got similar insertion. Stylo is originating from lower part of salpingo we have done, and stylo is originating stelloid process. So by the name only it is clear. So lower aspect or medial aspect of stelloid process is the better one. So it is originating from medial aspect of the base of stelloid process. So you all know stelloid process of which bone? Stelloid process of temporal bone. So insertion of these three muscles togetherly, they are inserting into the thyroid cartilage posterior lamina. So done with this, okay, and all these muscles are helping in deglutination of food. So yes, in short we have finished this whole of the muscle. Before that, before ending, I would like to show you this diagram. Now what was asked, now this, in this diagram you can clearly see that all this of the constrictor muscle, that is superior pharyngeal constrictor muscle. This is the superior pharyngeal constrictor muscle, okay, as this was the answer, as all constrictor muscle, this is the middle one and this is the inferior one. So see here, here one line is designated here, this line which you are seeing here in the midline, this line is the median fibrous raphe. Also here part of cricopharyngeus muscle has been shown. So these three muscles which is shown here is the three constrictor muscle, and all these constrictor muscle are inserting into median fibrous raphe. So a good diagram is this one is a better one, if you will see, where you can see superior, middle, inferior constrictor muscle inserting into median fibrous raphe, pharyngeal raphe, as you can see, midline median fibrous, and this is initial point where it is starting is the pharyngeal tubercle which was asked in the MCQ. This is pharyngeal tubercle, ending at the level of this pharyngeal raphe, ending at the level of C6 cervical vertebra. So longitudinal muscles also I want to show you. Here you can see the longitudinal muscles in this diagram. So here you can see salpingopharyngeus from the auditory tube cartilaginous part, palatopharyngeus as you can see in the form of fasciculi, it is in the form of fasciculi. You can see here it is in the form of fasciculi. So one side shown, anterior and posterior fasciculi from palatine aponeurosis, and stylopharyngeus from the stelloid process, stylopharyngeus from the stelloid process. Okay, so these three muscles are going and inserting into thyroid cartilage. So done with this. So in short, we have I have just briefed you about the pharynx muscle. So more in detail when the topic of pharynx I will give you more detail of each individual muscle attachments. Let's move on to the third MCQ. Nerve of pterygoid canal is composed of which of the following? Okay, nerve of pterygoid canal composed of which of the following? A, B, C, D and E. So this is again a direct MCQ. You have to just tell me how the formation of nerve of pterygoid canal takes place. So according to you, which is the correct answer, whether it is a lesser petrosal, deep petrosal, greater or deep petrosal, maxillary nerve or deep petrosal, or maxillary nerve greater petrosal. So you have to pick one of the answer. 5 options are there. Question number 3. Okay, deoxydabin has arrived. Okay, Neha Dikshit is telling it's A. Okay, Neha Dikshit is telling A. Deoxydabin is telling B. Okay. Okay, what about Acharya is telling 3B. Okay, Kumaran is telling B. So what's about others? nerve of pterygoid canal. So let me come up with the explanation of this MCQ. The correct answer is B, greater petrosal and deep petrosal. So most of you have given the right answer, okay, and it is absolutely right. It was a direct MCQ. So I would like to just write one line about it, and we have done with this MCQ. So please all of you just note down. Most of the students, I think most or all has given the right answer. So great. Now greater petrosal nerve. So actually greater petrosal nerve is a branch of which nerve? Can anybody tell me? It's a branch of which nerve? Greater petrosal nerve. It arises from which nerve? Anyone can tell me? It is actually parasympathetic. It is carrying parasympathetic fibers of, it carries parasympathetic fibers of facial nerve. It's a branch of facial nerve carrying parasympathetic fibers. This joins with the other nerve that is called as deep petrosal nerve. Absolutely right, Deoxy. It joins with deep petrosal nerve. Okay, these. And what is deep petrosal nerve? So it is actually formed by sympathetic nerve plexus which is lying around internal carotid artery. Deep petrosal nerve is formed by sympathetic plexus around internal carotid artery, and these two structures, greater petrosal and deep petrosal nerve, that is, these two structures will together form which nerve? Will together lead to the formation of nerve to pterygoid canal. Nerve to pterygoid canal. Absolutely right. Acharya has given the whole explanation also. So great, Acharya, absolutely right. Acharya is absolutely right. Now moving on to the next MCQ, that is MCQ number 4. Okay, so your time starts now. So which nerve is not contained within the cavernous sinus? Okay, so you have to tell me the answer. Which of the following, it's the MCQ number 4th. So which of the following nerve is not contained, within the cavernous sinus? So your time begins now. So yes, Akshay Bhatt has also given the answer. The nerve of pterygoid canal is also called as Weiden nerve. Absolutely right, Bhatt, you are absolutely right. Yes, it is called as Weiden nerve also. So yes, which nerve is not contained within the cavernous sinus? Today I told you I have included some one-liners, so we will slightly move faster. So yes, my dear friends, I am so happy many of the correct answers are coming up, and absolutely right, yes, optic nerve is not contained in cavernous sinus. Rest all nerves which is mentioned here, that is oculomotor, trochlear, trigeminal, ophthalmic division, abducens nerves are sure shot contained in cavernous sinus, and cavernous sinus also contains maxillary division of trigeminal nerve sometimes. So yes, all of you are absolutely correct. It's not the A optic nerve. So let me just show you the diagram, I think. So I would directly go to the diagram. So just a quick revision, most of you are already knowing the facts. So yes, here the nerves has been shown, and I just want to show you the nerves in the lateral wall of the cavernous sinus, the nerves which is lying in the lateral wall of cavernous sinus. So here we can see the nerves has been shown. This is the oculomotor nerve, the trochlear nerve, lower to it is the ophthalmic nerve, that is the trigeminal nerve first division, ophthalmic nerve, trigeminal nerve first division, and the maxillary nerve. So these four nerves, oculomotor, trochlear, ophthalmic and maxillary, these four nerves are located in where? Lateral wall of cavernous sinus, and you can see two structures is traversing through the cavernous sinus. That two structures which is traversing through the cavernous sinus are, so let me just highlight it. One is the internal carotid artery which is shown here. This is the internal carotid artery. This artery which you are seeing here, this internal carotid artery. So this internal carotid artery which is nicely shown here. So this is traversing inside internal carotid artery. So yes. What about the other structure? The other one is the nerve, that is the abducens nerve, which is the abducens nerve. So here abducens and internal carotid artery is traversing through cavernous sinus. So yes, let's move on to the next MCQ, that is MCQ number 5th. Okay, MCQ number 5th. So one of the student has told me, ma'am, please include MCQ or details of muscles of mastication. So I have included the MCQ related to that topic. Yeah. Which of the following depresses the mandible? So options are lateral pterygoid, medial pterygoid, temporalis, masseter and mylohyoid. Okay. Lateral pterygoid, medial pterygoid, temporalis, masseter and mylohyoid. So according to you, which is the correct one? Which of the following depresses the mandible? So yeah. So Bharat is telling it's lateral pterygoid. Okay, what about others? Medial pterygoid, lateral. Okay, lateral pterygoid A. Okay. Kumaran has changed, I think, his answer once more. Okay. So yes, we have two prime depressor. Okay. So yes. Let's see. So Bhatt is also giving the whole of the action of lateral pterygoid muscle. So yes, the correct answer here is lateral pterygoid. So A is absolutely correct. All other muscles are not depressing. Actually, lateral pterygoid is depressing, is the only one muscle of mastication which is depressing, but it does this action in along with the associated supra and infrahyoid muscle. But we have to choose one, then the lateral pterygoid is the correct answer. So let me tell you the action of each muscle here which was mentioned in the MCQ. Okay. So one muscle was the lateral pterygoid, which we have just seen that it is acting, it is causing depression of the mandible. So it depresses the mandible, okay, depresses the mandible and also protrude the mandible. So along with medial and lateral pterygoid together, they are also causing side to side movement. Okay. So medial pterygoid, when we talk about medial pterygoid muscle, it is causing elevation of mandible and this muscle also protrude the mandible. Okay. Temporalis muscle, when we talk about temporalis muscle, it is also causing elevation, but the posterior fibers of temporalis muscle is also causing retraction of the mandible. And when we are talking about masseter muscle, when we are talking about the masseter muscle, this is also causing elevation of the mandible. So as I told you, mylohyoid, this is the muscle which is the suprahyoid muscle. It is also acting along with the gravity, along with the lateral pterygoid muscle, and it is involved in the depression of the mandible. So yes, let's move on to further details. So I want to tell you about the muscle, I want to show you the muscle and then to tell you about the origin, insertion in brief about these muscles. So let's move on to the first diagram. So here, my dear friends, you can visualize this diagram. Is it visible? Yeah. So we are seeing in this diagram two muscles. Okay, one is the lateral pterygoid, another is the medial pterygoid. Okay. So in brief, I would like to tell you about its origin and insertion. So in brief, I would like to tell you. So here you can see in this diagram, when you see in the lateral pterygoid muscle, that this lateral pterygoid muscle is having two heads of origin. Okay, it is having two heads of origin. This is U for the upper head and this is L for the lower head. Is it clear? I have written U and L. So U for the upper head and L for the medial head. These are the two heads of which muscle? Lateral pterygoid muscle. Lateral pterygoid muscle. Which muscle is this, my dear friend? This is which muscle? These muscles are lateral pterygoid muscle. And lower to it is, you are also seeing the medial pterygoid muscle. So here in this diagram, if you will see nicely, the two muscles which is shown here, the upper head, this is the upper head and this is the lower head. Okay. So which I am highlighting here is the upper and the lower head, which you are seeing, the upper and the lower head. And you can see the upper and the lower head of the lateral pterygoid muscle, is going towards TM joint. It is going towards this joint. What is this? This is TM joint. They are going towards the TM joint. Here this structure which you are seeing, which I will use blue color for it. Okay, what is this? This is articular disc. So let me slightly enlarge this. Okay, this is the articular disc. Okay, this is the articular disc. The blue color structure which I am showing you is the articular disc, and you can clearly see that these lateral pterygoid muscle, both the upper and lower head, is going towards TM joint, fibrous capsule, articular disc, and also related to the mandible here. That reason is the location of pterygoid fovea. So we are done with the origin insertion. Origin is from the sphenoid bone and from the lateral pterygoid plate. So this part of the bone which you are seeing is the lateral pterygoid plate, LP for lateral pterygoid plate, outer aspect of the lateral pterygoid plate. It's the other muscle which you are seeing, which I would like to highlight with the other color. Okay, this muscle which you are seeing is the two fibers of, okay, here you can see these are the two fibers of the muscle which is seen. One is the superficial fiber and the other is the deep fiber. So there is deep head of lateral pterygoid muscle and there is superficial head of lateral pterygoid muscle. So medial pterygoid muscle, sorry. In case of medial pterygoid muscle, there is superficial and deep head. In case of lateral pterygoid muscle, there is upper and lower head. Now my dear friends, the deep head of lateral pterygoid muscle is lying very close to that of the lateral pterygoid plate. So my dear friends, it is originating from lateral pterygoid plate. It is originating from which structure? It is originating from lateral pterygoid plate. Okay, it's originating from lateral pterygoid plate as shown here. Lateral pterygoid plate, no doubt about this. But the medial pterygoid, the deep head of the medial pterygoid muscle will originate from the medial aspect of lateral pterygoid plate, and superficial head will originate from maxillary tuberosity. So is it clear by the diagram? So let me just write in brief so that you can revise it. Okay. So let me give you the details of this. So please complete firstly the pterygoid muscle, because slightly there is confusion in the pterygoid muscle origin and insertion. Masseter and temporalis is very easy. So firstly I would like to give you the origin insertion, detail of origin and insertion of pterygoid muscles. So firstly starting with the lateral pterygoid muscle. Lateral pterygoid muscle. So when we talk about lateral pterygoid muscle, it is having two heads. One is the upper head. Upper head originates from infratemporal surface of it originates from infratemporal surface of and the crest of greater wing of sphenoid. Greater wing of which bone? Sphenoid bone, the butterfly bone. Okay, this is the origin for the lateral pterygoid upper head. When we talk about the lower head of lateral pterygoid muscle, I have shown you the lower head of lateral pterygoid muscle is originating from lateral aspect of, it originates from lateral aspect of lateral pterygoid plate. Okay, so this is the lower and this is the upper head, A and B, and both upper and lower head, where is these inserting? So what about the insertion? So insertion of lateral pterygoid muscle is, lateral pterygoid muscle inserts on which structure? It inserts onto the fibrous capsule of TM joint. It inserts into articular disc of TM joint and pterygoid fovea of mandible bone. Pterygoid fovea of the mandible bone. So this is all about the lateral pterygoid muscle origin insertion. Moving to the medial pterygoid muscle. So next muscle is medial pterygoid muscle. So when we are talking about medial pterygoid muscle, it is having two heads. One is superficial, another is deep. Superficial head is originating from which structure? Maxillary tuberosity. So it is originating from maxillary tuberosity. If you want to know more, it is also taking few ticks of origin from the pyramidal plate of palatine bone. So also originating from pyramidal, lateral aspect of pyramidal plate of palatine bone. What about the deep head? So just now we have seen also deep head is also originating close to the lateral pterygoid plate, but it is originating from medial aspect or medial surface of lateral pterygoid plate. And when we talk about insertion, my dear friends, this muscle is going on the inner aspect of the mandible. It is going inside, inserting into the medial aspect of the ramus of the mandible. So it is inserting into the medial aspect of ramus of mandible. So done with the pterygoid muscle, actions done. Nerve supply, all the, can anybody tell me, all the muscles of mastication is getting innervation from which nerve? All the muscles of mastication is getting innervation from which nerve? Anyone? They are all getting innervation from mandibular nerve, branch of trigeminal nerve. So let's move on to the next, that is the temporalis and masseter. Now my dear friend, in this diagram I want to highlight two muscles. This muscle which you are seeing, the muscle which you are seeing, this muscle is the temporalis muscle which you are seeing. This is the whole outline of temporalis, and this quadrilateral shape muscle which is lying on the outer aspect of the mandible, this is the masseter muscle. So here this is the temporalis muscle and this is the mandibular. Yes, but absolutely right, this is the masseter muscle. This is the masseter muscle. Now temporalis muscle is originating from temporal bone, temporal fossa floor and fascia, also temporal fossa floor and temporal fascia, and insertion is occurring into the mandible coronoid process. Masseter, as you can see in the outer, when you will clench your teeth, you can feel this quadrilateral muscle. Just clench your teeth and touch it. The quadrilateral muscle which you can feel is the masseter muscle. So where it is originating and inserting, when we talk about the masseter muscle, here is the cheekbone. Okay, this is the cheekbone. Okay, so masseter muscle is originating from cheekbone and inserting in the outer aspect of the ramus of mandible. So write down, masseter muscle is originating from zygomatic bone, which is the cheekbone, zygomatic bone, and where it is inserting, as so clear in the diagram also, it is inserting. When we talk about insertion, it is inserting in outer aspect of ramus of mandible, ramus of mandible. So I think this is okay. So everyone, have you understood the, in short? So one of the student has told me, so I have included this diagram. So in short, we have done with the muscles of mastication, origin, insertion, nerve supply and action. Any doubt or is it clear? Everyone, do you want to see the diagram once again or is it clear? So temporalis and masseter is very easy, as you can see, and if you will see, yes, facial nerve is facial nerve sensory supply to face, trigeminal nerve, three sense, no, Sirja. For the face area innervation, sensory innervation, if you talk about facial nerve, no, that's not correct. That is the three areas, ophthalmic, maxillary and mandibular, that is sensory innervation. Okay, mandibular nerve is the muscle of mastication, mandibular, yes, it is a motor, yes. So got it? Sensory part of this is coda tympanic nerve of the facial nerve. So yes, we have seen also, and you can see the mandible bone has been dissected out, cuts to show you the medial pterygoid muscle going inside. Okay, facial muscles is facial muscle when we are talking, so Srija is slightly confused. Okay, so I will just Sarans Acharya, facial is a muscle of facial expression. Facial muscle of expression is getting innervation from facial nerve, terminal branches. Okay, so facial nerve terminal branches are temporal, zygomatic, buccal, marginal, mandibular, okay, and that of cervical. So these branches are supplying facial muscle. So if it is supplying muscle, that means it is motor supply. Okay. Sensory, when we are talking about the skin on the face, when we are talking about the skin on the face, it is by the ophthalmic, maxillary and mandibular division of trigeminal nerve. Is it okay, Acharya? Got it, Acharya? Got it, Acharya? Bharat, nerve supply. Actually, nerve supply, in just one line you remember, nerve supply of all the muscles of mastication is by mandibular nerve, and mandibular nerve is a branch of trigeminal nerve. Okay. Bharat, all the muscles of mastication is getting innervation from mandibular nerve. Mandibular nerve is a branch of trigeminal nerve. So, Bharat, is it okay? Acharya, is it okay? Have you understood, Acharya? Srija, everyone, can we move on to the next MCQ? So, let's move on to the next MCQ. Okay, before going into the next MCQ, I would like to give you the brief of the iconic subscription of Unacademy, my dear friends. Okay, I got it. Okay, yeah, I got it, everyone. Okay, it's clear. Yes, anterior division of mandibular. Yes, anterior division is mainly motor. Yeah, anterior division of mandibular nerve is motor. Posterior division is mainly sensory branches like auriculotemporal, lingual, inferior alveolar. Okay, got it? But so yes, they are all telling the things which you are knowing the facts. Okay, great. So I got it. Okay, that was not a doubt. I feel that was a doubt. Okay, so yeah. Now, iconic subscription where the prep ladder and Unacademy is merged. So, you can avail the opportunity of prep ladder and also Unacademy. What is the plus point of Unacademy is live session. What is the plus point of plus courses? A systematic course along with PDF notes, live interaction, along with the mentorship with the Unacademy educators. There will be MCQ session. Every fourth session on the plus platform is a doubt clearing session. So, many benefits are there. So, you can avail this opportunity along with the video lectures and Q bank of prep ladder. You can just use my code NAT10 for getting 10% discount. Now, boost your preparation, my dear friends, by taking the 3-month subscription of Unacademy and getting additional 1 month absolutely free. So, you just use the code NAT10 for taking 3-month subscription, you will get another 1 month absolutely free. So, upcoming sessions, I want to give a brief. MBBS second year batch course is coming up. MBBS professional year third batch is coming. For any of these sessions, you can use my code. The target batch of next is already done and coming up. So, here anatomy is completed by me. So, you can be the part of this session. Entire anatomy will be finished. So, you can use the code NAT10 for taking the 10% discount. 34,000 MCQs are there on the platform, plus platform of Unacademy. So, don't waste it. Be the part to avail this opportunity, and sure shot you are going to crack your examination. So, what about the new user? Just download the Unacademy app, use the code NAT10. You can use this code NAT10 for availing the opportunity of seeing free sessions of mine on the Unacademy platform, and also for taking the subscription of plus platform on the Unacademy. So, this is the benefit of this code, and just you have to see which course is suiting you, whether you want to take the subscription of 1 month, 3 months, 6 months, 12 months or 2 years, 3 years, whichever you feel is okay for you. You just take the subscription. You can use the code NAT10 for 10% discount. Now, live sessions, and what is the benefits of Unacademy sessions is live class sessions is there, weekly test is there, and unlimited access is there. My dear friends, you can see the session number of times. It's not just 1 time, 2 time, it's like more than 100 times if you want, but there will be not that much of time with you. So, be the part of live session, and in case you are very busy, you can see the sessions afterwards also, recorded version. You can ask your doubts, you can tell your view, please the educators too, you can tell your view that you should cover this topic or that. So, many educators are there and many sessions are there. And one more point is that if you take a subscription of Unacademy, it's not that you can be a part of one course only. You can be the part of many courses at the same time. So, that is the plus platform. So, let's start with the 6th MCQ, all of you. Okay, let's start with the 6th MCQ. Okay, which nerve arises by 2 roots and surrounds the middle meningeal artery? Which nerve arises by 2 roots and surrounds the middle meningeal artery? Okay. So, 5 options are there. auriculotemporal, buccal, mental, zygomatico-temporal, zygomatico-facial. So we will directly, so I will, these are direct MCQs, so not much of concept is applied. So you have to give me the correct answer. I will show you the diagram, which is, so I got Bhatt has given the answer. What about others? Bharat has given the answer. Bhatt Kumaran has given the answer. So yes, let me explain the correct answer. Actually, the correct answer is A, that is auriculotemporal nerve. So question number 6, the correct answer is auriculotemporal. Actually, yes, 6A, absolutely right, everyone. This is the nerve which is a branch from posterior division of mandibular nerve, and this nerve, when arises, it forms a loop around the middle meningeal artery. So I would like to show you that diagram also. So let me just highlight this diagram, enlarge this diagram. So yes, this is the enlarged view, as you can see. Now here I want you to show one artery. So here you can visualize, this is the auriculotemporal nerve. This is auriculotemporal nerve. Here you can see this auriculotemporal nerve is surrounding an artery. So let me just use pink color for this artery. Okay, this is the artery. Okay, this is the middle meningeal artery. So okay, let me just enlarge the diagram here itself, this part only, okay, because this is asked here. So this artery is, this is the artery, this is the middle meningeal artery, and what you can appreciate here in the diagram, what you can appreciate here, that this middle meningeal artery is covered by a looping. Can you see this loop which is forming around this loop which you are seeing, this loop which you are seeing, which I have highlighted in black color, the loop, this loop is of which nerve? Which nerve is this? This is auriculotemporal nerve, and the artery which is surrounding, which I have shown in pink color, what is this artery? This artery is middle meningeal artery, MMA. So it's quite clear to you. I have enlarged it and I am showing you that middle meningeal artery is forming a loop around auriculotemporal nerve. So it was a direct MCQ and all of you have mentioned it's right. So just a revision for this MCQ. So great. So let's move on to the next. A direct MCQ was that. So let's move on to the next MCQ. If you have targeted my previous session and seen my previous session, everyone will give the correct answer. Centroacinar cells are present in which of the following is the right answer? Whether it is present in parotid gland, pancreas, prostate or none. Centroacinar cells are present where? Parotid, prostate, pancreas, none. Which is your correct answer? So yes, Bharat is telling it's B. What about others? Acharya B, Dev Soni B, okay. Shweta B, Modi B, okay. So today in the direct MCQ many correct answers are coming. So I am also very glad for it. Nice. So yes, most of the students are exactly correct. Most of the students are exactly correct. The correct answer is B. Yeah, the correct answer is B. So pancreas is the correct answer. Yes, absolutely right, dear. Pancreas is the correct answer. Yes. Now actually I want to show you this diagram. Okay. So in this diagram, what is centroacinar cells? Actually, centroacinar cells is the part of the duct. So we know that, can you see the green color structure? What is it? It is a sinus. Okay. So in case of pancreas, we have got exo and endocrine part. All of you know that pancreas is having both exo and endocrine part. So when we are talking about exocrine part, it is having serous acini. Pancreas is having serous acini. So it is having serous acini. Now generally what happens in case of serous acini, the duct will arise from the exterior part of the acini. So means from here the duct should arise. But if you will see, this is centroacinar cells of pancreas. But in case of pancreas, the intercalated duct, which is the initial part of duct, is not present here. In place of that, you can see the most initial part of the duct. So what is these? These are the parts of the duct, and this is the I for initial or initial. So you can see initial part of the duct is going inside the acini. It is protruding inside. So it appears like how I remember, I will tell you. I remember like there is a balloon, and in that balloon I have put a pen inside or a straw. So there is a balloon and we have put a straw inside. So what will happen? We are putting the straw like this inside. So a part of the straw will be surrounded by the part of acini. If there is something like a rounded structure, like for example a balloon is there and we are pushing inside one duct. So my pen is a duct, okay. So initial part, my pen starting nip point is the duct. So it is going inside the acini and part of acini is surrounding it. So the part of acini which is surrounding the initial part of the duct, that is called as centroacinar cell, and this is the characteristic feature of identification of pancreas. Everyone, is it clear? Yes, that is the initial part of the duct which is lying inside the acini, and this is the characteristic feature of acini which is only seen in case of pancreas. Now I am also showing you this slide. Let me just slightly highlight this. Okay. Now my dear friends, here this is a very enlarged view which is shown to you, okay. Okay. So there is an enlarged view which you can see here, and what you can see, there is a blackened dot which you are seeing, black colored dot. That blackened dot is like an acini. This is an enlarged view of an acini. This is which acini, my dear friend? This is serous acini, and inside that acini, inside that balloon which you are seeing, and inside which which is just for an explanation, it's the inside you can see this acini. What is this? This is the nucleus of centroacinar cell. So very nice. Today's students are understanding also very nicely and they are replying also. I am very glad. Okay, got it everyone? Crystal clear to everyone? So this is a slide showing you the nucleus of centroacinar cell. And this is the duct which you are seeing. Initial part of it is lying inside. So let's move on to the next one, that is question number 8. Everyone, let's start with the question number 8. Question number 8, lining epithelium of fallopian tube. Lining epithelium of fallopian tube is what is the answer, dear? Is it simple columnar? Is it pseudo-stratified columnar? Is it ciliated columnar? Is it simple cuboidal? So according to you, which is the correct answer? Question number 8. Okay, deoxy is telling it's C. Okay, great. So many of the students are giving the right answer and most of the students are telling it's C. Okay, so lining epithelium, histology is clear to everyone. Great point. Yeah. So the correct answer is also this, that is ciliated columnar epithelium, and all of you are absolutely right. Let me show you the epithelium lining of fallopian tube. So how we are going to identify the epithelium is by seeing a star-shaped lumen. So we can see a fallopian tube, uterine tube. No, Kumaran, it's ciliated columnar, not pseudo-stratified. It's ciliated columnar, dear. It's ciliated columnar. Kumaran, it's ciliated columnar, dear. Okay. So see here, I have included a slide of fallopian tube. So can anybody see here? So yes, this lumen which you are seeing. So this is first the. So very nicely you can see here. Let me just. Okay. So this is the epithelium which you are seeing. This is the epithelium which you are seeing. Ciliated epithelium, dear. So it's not pseudo-stratified. Okay, it's not pseudo-stratified, dear. So see here, this is the epithelium. Here I am showing you the diagram. It's ciliated columnar, not pseudo-stratified. Pseudo-stratified is respiratory epithelium. Pseudo-stratified you will find in respiratory epithelium. Okay, my dear friends, so this is the epithelium which you are seeing. This is the epithelium, and see here it is columnar in shape. It is columnar in shape, and very nicely you can see. Yes, Acharya has also given you the answer. It's ciliated columnar epithelium only in and ciliated pseudo-stratified respiratory epithelium. Absolutely right, dear. So yes, it's okay, we can revise it. Confusion can happen, nothing to worry about it. So this is the nucleus. Can you see, this is columnar, this is high power view where I am showing you the nucleus. So in case of columnar epithelium, this is N for nucleus. In case of columnar epithelium, the nucleus is towards the base. So see here, this part which you are seeing here, it is the star-shaped lumen which you are seeing. This is irregular star-shaped lumen of fallopian tube is seen. This is the lumen of fallopian tube. Lining epithelium is ciliated columnar epithelium, okay. So, and some secretory cells are also lying inside. They are non-ciliated. Some secretory cell will be non-ciliated, and this hole is the lumen. The yellow color structure which I am highlighting here, this hole is the lumen. So, is it clear? Can we move on to the next MCQ? Everyone, let's move on to the next. Yeah, revision and confusion is a common thing. When we study, we get confused. Nothing to worry. We should clear our confusion. That is a good point. Okay. So, nothing to worry, Kumaran. It happens. It happens. If you read, then only there will be confusion. So, it happens always. When we also study something, we mug up something and we feel that this would be right, that would be right. So, it happens with everyone. So, let's move on to the next MCQ, that is MCQ number 9th. Sacral ala is not crossed by. Question number 9. Sacral ala is not crossed by which of the following structure? Is it obturator nerve, iliolumbar artery, sympathetic chain or ureter? So, according to you, which is the correct answer? Sacral ala of the sacrum is not crossed by which of the following structure? A, B, C, D. So, I got an answer. Acharya is telling it's A. Okay, what about others? Deoxydabin is telling it's A. So, Sarma is telling, Prakhar Sarma is telling A. Anyone else? So, let's move on to the answer. Actually, most of you, all of you are correct, and yes, A is the correct answer. Ureter is not lying in relation with the sacral ala. Rest all the structures, sympathetic chain, iliolumbar, obturator. So, actually, how many structures are related on the ala of the sacrum? Anybody? Can you tell me it's whether it is 3 or 4 structures? Whether it is 3 or 4 structure? Oils, oh very nice. Yes, mnemonic is oils. Yes, O-I-L-S. O for obturator nerve, I for iliolumbar artery, L for lumbosacral trunk, S for sympathetic chain. Yeah. So, oils is from lateral to medial, I think. Okay. So, let me show you a diagram and I will write this for you. Kumaran, absolutely right. Kumaran, you are absolutely right. So, let's write here. So, one thing I just want to note down and then I will show you in the diagram. Sacral ala is related to following structures from medial to lateral. The structure is related from medial to lateral. So, the medial most structure is sympathetic chain, lumbosacral trunk. The joining of the 5th lumbar nerve with the sacral nerve is called lumbosacral trunk. Srija, lumbosacral trunk, the joining of the 5th lumbar nerve with the 1st sacral, lumbosacral trunk, iliolumbar artery and obturator nerve. So, very nice mnemonic is given by Kumaran. The mnemonic is oils. O-I-L-S. So, I think it will go from, I have written medial to lateral. According to Kumaran, it will be not exactly right, it will be just the reverse, lateral to medial, I think. Yeah. So, let me show you this diagram. Okay. So, here this part, as you already know, this part is the sacrum. This part is the ala of the sacrum, and I just want to give you the structures as we move from medial to lateral. Okay. So, medial most structure is sympathetic trunk. So, one structure I have made, the medial most, one structure I have, I just will go more medially. Okay, medial most structure. Then lumbosacral trunk is there. Then is one artery. Then is one another nerve, lest one more nerve, so I will just use like this. Okay, these structures are related. So yes, the structure which is lying, the structure, this structure, the first structure, this is the first structure which is ST for sympathetic trunk. This is the second structure, this is lumbosacral trunk. Which is the third structure, red color, this is the artery, iliolumbar artery, iliolumbar artery. Which is the fourth structure, my dear friends? It is the obturator nerve, obturator nerve. This is the fourth structure. Okay, so everyone, is it okay? Can we move on to the next structure? This is the fourth structure related on the ala of the sacrum. So O for obturator, I for iliolumbar, L for lumbosacral trunk, and S for sympathetic S for sympathetic chain, sympathetic trunk or sympathetic oils. So oils, the structure is relation will be from lateral to medial. So I also like this mnemonic very much. So who have given this mnemonic? Kumaran, great Kumaran. So is it okay everyone? Let's move on to the next. Let's move on to the next. Okay, great one. So let's move on to the next one, next MCQ, that is MCQ number 10th. All are branches of inferior mesenteric artery except, all of the following are branches of inferior mesenteric artery except left colic, superior rectal, middle rectal, sigmoidal artery. Welcome dear, welcome Kumaran. So which is the correct answer? All of the following are branches of inferior mesenteric artery except left colic, superior rectal, middle rectal, sigmoidal artery. Question number 10. Okay, sigmoidal, deoxy is telling sigmoidal. Okay, some are telling D, sigmoidal, some are telling C, that is middle rectal. Wasim is telling C, Modi is telling C. So C and D, most of the answers are coming up C and D. So one is the correct and one is wrong. So actually C is the right answer, middle rectal. Middle rectal is a branch of which artery? It's the branch of superior mesenteric artery. It's a branch of superior mesenteric artery dear. It's not the branch of inferior mesenteric artery. Rest three branches are left colic and superior rectal and sigmoidal are branches of inferior mesenteric artery. Okay. So let me just show you the diagram for it. So let me show you this diagram. So here my dear friends, what you can see here that inferior mesenteric artery is arising from abdominal aorta at the level of L3 as shown in the diagram. Okay, this is the inferior mesenteric artery which is shown and three branches. So this is the left colic artery is the branch, sigmoidal artery is the branch, and it also terminates and continues as becoming the superior rectal artery. This is the third branch. So this three branches which is shown here. Okay, these three branches as it is shown here is the branches which is coming from, okay, it's the three branches which is left colic, sigmoidal, superior is the end artery of inferior. Okay, is it middle rectal or middle colic? Okay, it was middle rectal. I thought it's middle colic. Okay, yes, I thought it is middle colic, it's middle rectal. Okay, so yes, it is in internal iliac artery, absolutely right. Absolutely right dear, absolutely right. I thought it's middle colic. Yeah, who is this? Deoxydabin. Yeah, it's middle rectal. I thought it's middle colic. Ileocolic, middle colic, right colic, all these are branches from superior mesenteric. Okay. Yes, Deoxy, thank you for it. I got it's middle colic. Okay, by reading in the, yes. So middle rectal is the correct artery. It's not a branch from inferior mesenteric artery. If it was middle colic, so it was from the branch of superior mesenteric artery. So while making the question, I was thought to put middle colic. So only I have introduced this diagram also. See here middle colic artery. Is it okay, Deoxy? Middle colic, right colic. Okay, ileocolic. So in what is IPD? IPDA means IPD means inferior pancreatico-duodenal artery. IPDA, it's inferior pancreatico-duodenal artery. Okay. Yes, it continues at superior rectal artery continues as is a continuation of inferior mesenteric artery. The full form of IPDA is inferior pancreatico-duodenal artery. Inferior pancreatico-duodenal artery. It's inferior pancreatico-duodenal artery. So IPD, inferior pancreatico-duodenal artery, middle colic artery, right colic artery, ileocolic artery. All these are branches from superior mesenteric artery. Okay, and the option was middle colic artery. No, it was middle rectal, then it is the branch from internal iliac artery. Internal iliac artery has got anterior division and posterior division. From anterior division, we have got so many branches. We have got obturator artery, we have got uterine artery, we have got inferior gluteal artery, vaginal artery, inferior vesical artery, and from the posterior division, we have got iliolumbar artery, lateral sacral artery, superior gluteal artery. So is it okay, Deoxy? So that is the branches. So yes, so we have seen here the important branches of superior mesenteric and inferior mesenteric. So let's move on to before ending the session. So yes, maybe tomorrow I will take, so all of you, I just want to note down to you, tomorrow I will take a 30-minute session of MCQ, quick MCQs for 30 minutes. Is it okay, everyone? Okay. So before ending the session, I want to tell you about the MCQ marathon of FMGE entrance exam 2021. I am taking this as on the plus course. So this is a plus course on the Unacademy group, Unacademy app. So you can, if you wish, you can take the subscription and use the code ANAT10 for 10% discount. Okay. This is the schedule of the course, a total of 10 hours. So I have included total of 10 hours of my revision of all the anatomy through MCQ session. Okay, so we will have this whole of 10 hours. So whole of this is upper lower limb MCQs will be done on 29th. Okay, and also okay, so and also we have also got the thorax, abdomen, pelvis on the 29th, 1 to 3. We have got head, neck, neuroanatomy 30th. Then we have got embryology, histology. Then we have got cadaveric images and clinical. MCQs are also there. So those who want to be the part, they can be this part. Thank you so much. Yes, torus tuberculosis is have a function of any sort of artery like rudiment. Okay, mainly in many books it is still written as a rudiment. So they are going with the discovery and making of more research articles telling the functions. Okay, so I will get back to you, Deoxy, but till now it was like a rudiment only. Okay, so I will search on the research paper and let you know. Thank you dear Deoxy. And the free live sessions, which you can be the part of free live sessions, you can use the code ANAT10 for unlocking free live sessions. You can join me on my anatomy group, Monalisa Anatomy. You can ask your doubts of anatomy. You can follow me on the Unacademy app for my live updates of free sessions, also plus course. This is the schedule of this month. YouTube session 7:30 p.m. Okay, special session 9 p.m. for the FMGE and conceptual anatomy 6 p.m. So all the best, keep studying. Thank you. We will miss, I will again have this session tomorrow exactly. Okay, on YouTube. Thank you so much. Thank you, Deoxy, Srija and everyone. Thank you. So I am just ending the session. All the best. All the best. We will meet tomorrow at 7:30 p.m. Yeah. Thank you, dear.